human papilloma virus, HPV, is a virus spread through sexual contact and is the most common sexually transmitted infection with potentially fatal complications. It is notoriously linked to the development of cervical cancer in women. Dr. Alba Mendez is a gynecologist, obstetrician, and an oncologist. She says that people come in contact with HPV far more often and younger than we think.
HPV is a virus that really is only can appreciate by electronic microscope. That means it's minimal particle that normally most frequently transmission is sexually active. From the moment that we are sexually active, we have the chances that get this type of virus. Of course, right now try to push the use of condom, but in HPV this not cover 100%, will cover more or less 85%, based in that this type of virus is a little more resistant, that can pass the pores of the condom, and until that we continue get the risk of contract the HPV at the moment that sexual intercourse. A term of the first 3 years of sexually active show that more than 50% of the women have contact already with this microorganism. Not all of the women manifested any sign or symptoms, but at least in US, that is one of the countries that study a little more prolonged all of the population, they show that in teenagers, from the period of time that they started sexually active, after 3 years, more or less 50% of them was already in contact with any of these microorganisms, this virus.
Even though it is so common, many people never know that they have contracted HPV. This is why screening tests like pap smears and colposcopies are so important.
Sometimes we have discharge, sometimes we have problem with HPV, we don't have absolutely nothing. No signs, no symptoms, except in some special cases that we can observe some warts or something like that. That is the cervix, and this is the area that normally are the HPV virus are located, and they can stay there. Right there, they can start to produce, can stay and be in a latent manner. That means that we can see by pap smear, that we can see by colposcopy, but they are like dormant in this location. In this area, we have some cells that have the facility that produce cells that can go inside of the conduct or the cervical canal and outside. That is like the factory of cells. That normally when the virus penetrates in this, they have a DNA that go and get the memory of these cells. And normally when they start to damage, start to produce abnormal cells.
There are over 100 different types of the human papilloma virus, but only a few have been linked to cancer. Both men and women are susceptible to catching and transmitting the virus.
When man born, that not have, most of the time, not have this virus. But anytime he contract for some person that was infected, and generally have the capacity that pass to the carrier. At the same time, women can do the same process. What is the situation in this issue is that more sexual partners that we have, more exposure to different type of virus that we can get. Additionally, if no use protection, of course, our risk not only for HPV, for all of the STD.
Experts believe the HPV vaccine is the best tool in prevention. The HPV vaccine is a series of 3 shots over 6 months given to protect against HPV infection and other problems that HPV can cause.
At this moment, the vaccine that is the principal prevention, and was approved already for males. That for mothers that have girls, that have boys, my recommendation is let us work with really preventative measure. The vaccine is one of the goals in the trial of reduce cervical cancer everywhere. It have the possibilities and chances. I will put, my recommendation is vaccinate the kids.
Mm-hmm.
That's
Men
the first
and
one.
women, boys
Men,
and girls.
Boys and girls.
Additionally, Dr. Mendez says she hopes that someday Belize can develop a specialized clinic called a dysplasia clinic.
Dysplasia clinic is a clinic that have the colposcope, that have the instruments for take a biopsy. The colposcope is the guide for checking the cervix in patients that have abnormal pap smear, that have the forceps for get the piece of tissue or the cal biopsy and establish the diagnosis in a manner that do the follow-up correctly in case the precancerous lesion is a small surgery, a small procedure that can give at the same time to the patient, and this reduce the incidence of cancer and reduce the mortality for cervical cancer.
HPV cannot be treated, which is why screening tests are important. She encourages sexually active women to get their pap smear, starting with 1 a year for 3 consecutive years, a colposcopy, or HPV test for those over 30. As for the vaccine, the price tag is about $800, which Dr. Sosa says is a worthwhile investment.
When we put in one balance the life, and when it's the more precious life, because normally it's our kids, normally we need to try that checking, that the cost benefit is minimal compared with the benefit and reduction of possibility that